Hi, hello, welcome back. So today we are with a new interview questions, that is UAE guideline related question for medical coder. So today we are going to discuss the fourth question. So before that, if you haven't watched question number 1, 2, 3, I'll add up the iCard for the playlist. Please do check those questions also. So the question here which we are going to discuss is, how do you ensure that codes you use meet medical necessity guidelines? So this is a question which we are going to discuss today. So when an interviewer is asking you this question, how you have to answer. So I have created a PPT for this. Ensuring that the codes used in medical claims meet medical necessity guidelines is crucial for accurate billing, proper reimbursement and compliance with insurance policies. Medical necessity refer to the requirement that the treatment or service is clinically appropriate and essential for the patient diagnosis or condition. So the first thing what a medical coder should do is review the provided documentation. That is, thoroughly we have to review the documentation, read the patient condition, read the diagnosis, read the rationale, read the treatment and everything very properly. Ensure the chief complaint, diagnosis, clinical findings and treatment plans are well documented, as they provide a clear thing to find out the code. Second is use specific diagnosis code. After reviewing the documentation, you have to assign the ICD code as well as the CPT code. So here, first thing we have to assign that diagnosis code. Avoid using unspecified or less specific codes unless absolutely necessary. Third comes link diagnosis to procedure. So after coding the diagnosis, then you have to move to the CPT procedure code. For this, you have to go through the documentation very clearly and read and see like what procedure, like what diagnostic test is being done for the patient. Based on that, you have to assign the CPT code for the patient. Fourth comes follow payer guidelines. So we have to check the insurance part also. Be familiar with payer specific policies and guidelines such as those from insurance companies like Damam, Thika or international insurers. These guidelines often outline what condition qualify as medical necessary for certain procedure or treatment. Fifth comes apply national and local guidelines. Following national medical necessity guidelines from authorities like DHA or Health Authority Abu Dhabi, these local guidelines outline the medical necessity requirement for healthcare services in UAE. Stay updated with the guideline issued by professional organization like CMS or AAPC, as they set standard for what considered as a medical necessity. Sixth comes use of appropriate modifier. When necessary, apply modifier to clarify special circumstances that justify the medical necessity of a service. Example, modifier 25, modifier 26, whatever it is required. Based on that, you have to assign the modifiers very correctly. Next comes check for prior authorization. So prior authorization, some procedure require prior authorization from the payer before the service is performed to confirm that the treatment meets medical necessity requirement. Coders should ensure that correct codes are used when submitting prior authorization requests to avoid claim or denial. And then comes so these are the main thing which you should be very familiar. And then like we have to review the denial and feedback. If the claim is denied for a medical lack of medical necessity, review the feedback from the payer to identify what has gone wrong and make it clear and then resubmit. Last, stay updated with coding and regulatory changes. Regulatory update like regularly updating your knowledge of coding standards and regulations as they may evolve over time. Attending workshops, CUs may help you like clearly understand what are the updates happening recently. So ensure that the codes you use meet medical necessity guidelines. Involves accurately reviewing the documentation, using correct diagnosis and procedure code, following payer and national guideline, applying any necessary modifier, proper coding based on medical necessity. So that's all. These are the things you should be very familiar. So that's all about. Thank you so much for watching. If you have any doubts or if you have any queries, you can just mail me or you can just ping me in WhatsApp. And if you are looking for CPC certification training or interview guidance program, you can just contact us. Thank you so much. And if you haven't subscribed my channel, please do subscribe, and if you find it useful, please do share it with your friends also. Thank you so much for watching. Wish you all the best for your interview. Take care. Bye bye.